Hi everybody and good morning. Let's discuss today the common windows we use it for adult echocardiography. Remember, there are 5 windows we use it for adult echocardiography. The window we use it for the first from the application of echocardiography, which is parasternal long axis or plaques. And that one actually we put our probe to the notch of the transducer is towards the right shoulder, or you can say 10 o'clock. And then on the same spot, you just turn or you can tilt your probe. Instead of right shoulder, you make that notch of the transducer to the left shoulder, or you can say 1 o'clock. That will give you parasternal short axis. And then we move to the apical area. So from the apical area where the fourth and fifth intercostal area is most commonly that area, your notch of the transducer is towards the 3 o'clock or towards the bed because the patient is on LLD position, left lateral decubitus. So that will be your apical 4. To make it apical 5, just tilt the probe more superior. That will give you apical 5 chamber. To get apical 2 chamber, like left atrium and left ventricle. So in that case, what you can do, the notch of the transducer before it was on 3 o'clock, now you can make it 12 o'clock or between 12 and 1 o'clock. Everybody's body is a little different. That will give you 2 chamber view. And then if you want to get the 3 chamber, the 3 chamber is actually, it's like a parasternal long axis, but you take it from the apical area. What you do, the notch of the transducer is again towards the right shoulder, or we can say towards 10 o'clock, 10:30ish, something like that. And then to get the other wave, the third wave, it is subcostal. So from actually not the third, the fourth one, that is the subcostal. So you put your probe exactly by the subcostal area, but the notch of the transducer is again towards 3 o'clock, towards the bed. And then you will have a nice 4-chamber view in case if you want to rule out VSD or ASD or PFO, that's like the best window for this. And also for the pericardial effusion as well, and more. And then the last one, the 5th window, is actually we use it suprasternal notch. So you just put the probe here, more the notch of the transducer more towards 12 o'clock. And that will give you, if you tilt the probe more towards the right, the beam of the sound, that will give you ascending aorta. So you can put the color, you can do continuous wave, you can do pulse wave, you can do the 2D imaging from that area. And also you can just take it, if you tilt the probe more towards the left side, and that will give you descending thoracic aorta. And also you can see the arch area, all the 3 branches of the arch, innominate, left CCA and left subclavian. So these 5 windows, if we use them, so this way you will complete your application for the adult echocardiography. If there's any type of disease or any complaint the patient came to the hospital or to you, so that will be more easier to rule out if the patient have any type of heart disease or heart related disease. From these 5 windows, we can figure out, we can find out and rule out any disease. So I will strongly suggest use these windows and try to use and diagnose with sound, with ultrasound machine, with these probes, which are not radiation, which is safe, which is not expensive, which is more mobile, and it's quicker, it's bedside. So I will strongly suggest before you jump to something like a radiation or invasive procedure, better to diagnose with sonography or ultrasound or echocardiography. Take care.